welcome to the next episode of this Healthy Life podcast. I'm so excited about our guest today, one of my dear friends, Ali Moresco, and she is the founder of Moresco PR and Communications and specializes in entertainment PR, talent relations, and healthcare PR. And she is one of my dear friends, and she has an incredible journey that she went through and shifted her life, created her dream career, and is helping so many people now with the work that she does. So very excited to dive in and have everyone meet you and learn all about you today.
My God, thanks for having me. You make me sound way cooler than I am.
Aw, you are cool. You do cool stuff, and I love it. So let's start with sharing a little bit about your personal health journey and how it led you to create your current PR agency and working in healthcare and how you got into this space.
Oh gosh, I'm like, where do I start and how do I keep it short? So about 10 years ago, I was in celebrity and entertainment PR. Loved it. Very different industry, obviously, than I'm in now. Had just, in that year, started my own healthcare PR firm, was working with really cool clients, like Acura, Sundance Film Festival, and doing a lot of events and like celebrity talent relations. And then probably like so many listeners to your podcast, I got sick, with a mystery illness. And at first, my specialist thought I had thyroid cancer because my thyroid would swell and get bigger and smaller. And of course, was told by like certain thyroid specialists, they were like, oh, that's not possible. But here I was with like half of a golf ball on my neck. And thankfully that wasn't what it was. But 2 years, went on with no answers, being tested, for everything under the sun. And eventually a infectious disease doctor actually at Northwestern looked at me and was like, have you ever been tested for Lyme disease? And I was like, no. And sure enough, that's what I had. I had Lyme. So I know that obviously, as you know, Erica, just by being here on this podcast, you go through these crazy health journeys. And I think it really makes you wake up, right? To like the healthcare system, to what everybody's dealing with, to kind of the gaps, and you learn to become your own advocate. And you kind of don't know what you don't know until it happens to you.
Absolutely.
And I, spent a long time really, really sick. But I think it made me kind of realize my true passion in life, as cheesy as it sounds, in like helping others and, preventing other people from ending up like me with tick-borne illness, and kind of learned where, the gaps are in the system serving patients, and eventually found myself back in healthcare PR this time, and do a lot of like advocacy and philanthropy in the space. And but yeah, I feel like that's like the shortest version I can give of it.
Yeah, it's interesting how, once you go through this experience of having chronic illness, especially something like a mystery illness or a disease that's not really, quantified or believed in that it exists, when it truly is, and it's affecting so many millions of people, that it's like really hard for you to kind of go back to your old life. And, when you have all this new knowledge and all these people are suffering, and there's so much that you can do in this new space and try to bring awareness to it and make people aware of what's happening. So
absolutely.
Yeah, I love that, and also experience something similar. So I think that's
how we met.
Very, very life-changing.
Absolutely.
And so let's talk about a little bit about kind of how you created your agency that you have now, your PR agency. You kind of really had to manifest your own dream job and, work with your health and be able to kind of do both things. So can you talk a little bit about what that was kind of like, kind of rebuilding your brand and how you started off on the healthcare journey?
Yeah, absolutely. So, it's interesting because the way that we speak to patients suffering with a chronic disease, a complex inflammatory illness, anything like Lyme or tick-borne, that's chronic pain. What I noticed when I was going through my own healthcare journey is that the way that you are spoken to in advertising, in traditional media, and even sometimes non-traditional media, right? By people who don't actually understand what you're going through, because they thank God, right? They like don't have this problem themselves. They're kind of guessing what you want to hear or what your emotions are like, what you're feeling. And I always just felt like misunderstood, like nobody really understood me. And we see so much language in the health consumer space and the wellness consumer space around like, if you just do XYZ, you'll feel better. You'll have more energy. If you just work hard enough, if you put in enough effort. And like you and I both know that that is unfortunately not always the case. Or you and I would be like at 100% health, right?
Exactly.
We'd be living our best life. Healthiest people on the planet. So I had to take a 2-year break from work just because I essentially was bedridden and really got into the tick-borne disease philanthropy space, because that's how I found out that, past 30 days in most states, insurance doesn't have to cover treatment. And it really opened my eyes to like the mass amount of suffering that people were going through. And, had the opportunity through this philanthropic efforts to meet thousands of patients, across the US, and got to know so many people like me and their wants and their needs and what they were experiencing and what they were thinking. And I really never thought I would be well enough to work again. But when it finally slowly started to happen, I was like, if I'm going to go back to work, I'm going to do it to benefit the patient community. And that's how I went into healthcare PR. And I practice what I like to call patient-centered PR, because the type of public relations that I do is always at the benefit of the patient. It's with the heart of the patient in mind. It's around creating resources, filling needs, filling in gaps for patients. And the benefit of that, right, is that it benefits my clients. It benefits the brands that I work for, but it's mutually beneficial, which I feel like you don't often see in healthcare PR. So that's how I ended up in healthcare PR and kind of created my own little niche in this industry. And, I also am, and you and I talk about this offline, I feel like frequently, but I'm very spiritual. I'm very woo-woo, for lack of a better term. I believe in the universe and all the things and manifesting. But I also believe that, it's like you go on TikTok and, you see now hundreds of videos that will pop up on your timeline where it's like, just write down what you want and it's that easy. Just wish it to the universe. And I'm like, oh my God, once again, if only it was that easy, right? Like, I really believe that you have to put energy into things if you want them to manifest in your life. And so it's funny because I like to say that I created and manifested my dream career because it really didn't exist. But it also was like, looking back now, all of these small steps, almost like peeling an onion with a chronic disease, to get to like where I am now and create my career and manifest it.
That's amazing. I love that. And then, so can you share a little bit about, you, after you live through chronic illness, especially something like Lyme, it's something that you're basically managing Lyme or the aftermath basically for the rest of your life, unfortunately. So you kind of have a new normal and you can't maybe push yourself as much as you used to, or you have days you can and other days that you need to rest. How do you manage your health, kind of like maintaining your health and staying optimal while also kind of like pushing yourself in your work and your company and growing that as well?
It's a balance. I'm not going to lie to you. I'm not always very good at it. It's like that fine line of, thankfully now I feel pretty well. I'm like, not good.
Yay.
Most days, but I like don't always know when I've crossed the line. And then I'm like, oh shoot, I've like set myself back a little bit. I need to rest. I think I realized in my journey with chronic disease that we put so much of our identity into career and into work and into really mainstream achievements. And in reality, those don't have to be your identity. You can be passionate or feel strongly about like completely different things than most people. And I actually think that that's great. Like helping others, advocating for like legislative healthcare change. Like I have so many friends that that's their focus, like their passion in life. And I think that that's amazing. And when you become chronically ill, it hits you like a ton of bricks, even though it's like, when you look back, it kind of happens slowly over time. But you are forced to live this new normal. And I think you go through kind of a grieving period of your old life.
Absolutely.
And I think it's necessary. You can't just skate by it and like get away with it. You're really forced to like look at what you've lost, unfortunately. But I do believe that out of that can come something really beautiful that, not that I wish suffering upon anyone, like what I went through, like what you went through. But out of that comes something that I think really benefits yourself, really benefits others. And I think that like you and I are pretty good examples of that, that you can take what you've been through and really use it to build something else. Not to say that it's not, challenging. Trying to think like, what else do I have to say on this subject? Yeah, the new normal is hard. But eventually you do wrap your head around it. It's a balance.
Over time, it starts to get easier too. I think in the beginning, it's like really challenging because like you said, you're really mourning that old life that you had and all the things that you used to be able to do that just came so easily. And now it's like, even some days like doing a simple task like taking a shower can be exhausting, So it's like balancing that, spoon just theory. Like your basic human functions and needs. And then trying to run a company, and then other days you might be like, I feel totally normal, I feel on top of the world, like I can do everything today. So it's like, and you don't know how long that's going to last, so it's like you always have to just kind of learn to be flexible with your new normal.
Yes. And I think realizing it also forces you to realize, like, I think we're in, especially here in the US, if you're listening in the US, we're in such a society and a culture of productivity and high achievement. And I think we're really, really wrapped up in that. And it makes you feel like if you need to rest, you're lazy, right? Like there's something wrong with you. And in reality, nobody's built that way. Even quote unquote perfectly healthy people need to rest. Or like, I really believe that's why we have such a high incidence rate of like nervous system disorders, chronic adrenal fatigue, burnout, executive dysfunction, because we're just not meant to operate at that level 24/7. So even now I have days like, thankfully, most of my clients are in the chronic disease space. So like they get it, right? When I say like, oh, I'm really not feeling well. Or, about a month ago I had COVID and I really went down and I'm still kind of recovering now a month later. But thankfully, like they understand, but it still is a struggle, sometimes between like setting boundaries with people and not feeling bad about it because we're just so conditioned to operate at such a high level all the time. But, if you're somebody that's listening that needs a lot of rest, needs a lot of downtime to function, just know like there's nothing wrong with that. We all do.
You almost start to kind of feel guilty too, because you're just like, oh, I don't feel good today, I feel tired. But like 5 years later you're like still saying the same thing, but it's like your new reality, and just like you're not using it as an excuse. It's just your body is like not functioning well that day. So it's like you can kind of put a lot of guilt on yourself that you shouldn't be putting on too.
Absolutely. You said it perfectly.
Yeah. Awesome. And then so you went from working with big brands like Nike, and you mentioned some celebrity work and Sundance and things like that. How do you carry over some of that experience and what you enjoyed in that and use that in the healthcare space as well? Because it's very different types of PR, very different types of brands that you're working with and kind of missions. So how do you kind of pull from it what you liked and kind of create a new strategy and method for the healthcare space?
Yeah, that's a great question. I think a lot of the bones of PR, no matter what industry you're in, are very similar, right? You're working with media, you're pitching media, you're trying to, in the traditional sense, like you're trying to share, like, why is my client interesting? Why is this story like topically relevant? Why would people want to read about it? And whether you're pitching somebody in the celebrity space or a healthcare brand with a story, that's very similar. I also think a lot of I do a lot of celebrity work for my healthcare clients, in the, supplement space, in the nonprofit space and things of that nature. And it's been really nice because I've been able to pull a lot of my celebrity relations experience over into those roles to benefit my clients. PR and communications, traditional media, social media, it's ever evolving, like week to week. Sometimes it looks so different. A new app launches. There's a new trend. There's a new hot button topic. It's like, it's it's ever evolving. So I think even if I had stayed for some reason in celebrity PR, I think it would be completely different, than it was then. Um, it's just kind of a
Yeah,
wild
so many
industry, I
new
guess, like
channels and
anything. Yes, you
yeah.
get it. Yeah.
Awesome. And then, so let's talk a little bit about some of the advocacy and nonprofit work you do. I know that's been a big part of your journey, and making sure that there's awareness for Lyme disease and working with nonprofits and helping people get access to healthcare. I'd love if you could share a little bit about some of your work with that and what nonprofits you're currently working with.
Yeah, absolutely. So it's funny to look back on because when I had to stop working because I was sick and I started like really realizing the impact of and like the ramifications on specifically Lyme and tick-borne patients. I was like, okay, I have to do something. I have to get involved in some way. So I like blindly emailed this nonprofit on the East Coast and was like, hi, let me work with you. And it took them 3 months, but they emailed me back. So I started working with this nonprofit on the East Coast and kind of like learned the ropes and learned, what it really takes to get research done, to fund research, the lack of awareness around Lyme and tick-borne illness, and what we really needed to see happen, to create legitimacy, around the disease that we both know, obviously, so many millions of people suffer from. And so now it's been about 6 years of working in the Lyme nonprofit space as a volunteer, just raising money, throwing events, stuff like that. And then about a year ago, I was elected to the board of Project Lyme. And I actually, as of last week, was just elected the executive board chair of Project Lyme, which I'm
Amazing.
really, really excited
Congratulations.
about.
That's
Thank
awesome.
you. So what I would, really like to see happen in the next like 5 to 10 years generally, and this isn't exclusive to Project Lyme. I think all of the organizations can kind of figure this out together, but I would like to see some mainstream awareness and education and medical training, around Lyme and tick-borne disease. And I think there was an executive director for Global Lyme Alliance that I loved, this guy, Scott Santarella, who came from the cancer nonprofit world, who I did a lot of work with. And he used to say that Lyme and tick-borne was about 20 to 25 years behind cancer research. So my hope is that in our lifetime, we're going to see kind of the validity and the research that we need to come up with treatments and testing and things of that nature. But for me, it has just become like my ultimate passion in life, doing this type of work and seeing the research published. And I love throwing events and bringing communities together because I think Lyme and tick-borne disease can just be so isolating. And we get so much great communication online, so much information online, but being able to actually come together in person sometimes, in a room full of other people that just innately understand you and you don't have to say 2 words, I think is a really special thing. So I love that. Yeah, I could blabber on about this.
And then let's talk a little bit more about Project Lyme. So what are some of the goals or missions that Project Lyme is working on this year and kind of creating space for?
Yeah, so we have 3 main initiatives: fund research that hopefully gets published, general patient advocacy, and education and awareness. So one of our initiatives actually that just started to roll out across the US was we had filmed and funded 4 PSAs, anywhere from 15 seconds to a minute long, with 2 families of 2, unfortunately, small children that both suffer from Lyme disease, Pippa and Rylan. And the whole theme of these campaigns was it could be Lyme, right? Because I see this theme in my own career work. I see this theme through nonprofit work. And I think about my own journey, and probably for you too, where you have all these mystery symptoms. You're trying to figure out what's wrong with you. You don't know to Google Lyme disease, right? So just like that super simple initiative of making people aware that, hey, if you have one of these 350 symptoms that no one can figure out, it could be Lyme, I think is really critically important. We also at Project Lyme, as a part of our advocacy and patient advocacy and education, we give grants to other organizations like Limelight, to fund patient treatment grants, like Center for Lyme Action to fund legislative advocacy because they're a 501c4, so they can lobby. We fund research. A lot of our research is co-funded with Bay Area Lyme. So a lot through like Monic Embers at Tulane. I think in the last 2 to 3 months alone, we've had 3 studies come out, which is a pretty high,
Awesome.
incidence rate. Most things don't make it past, their first phase of research. So I feel like we're really making a difference, as everybody is, but it feels good to play a very small part in something like that.
No, that's great. Yeah. I mean, it's like, eventually someone's going to have to figure something out to,
Yes.
either have like an actual test that we can easily test for Lyme disease or put it more on the radar. And I think, every time I talk to people about Lyme, everyone has someone in their life that has Lyme. And it's just crazy how many people are affected. And you're the lucky ones if you know that you actually have Lyme, because like you said, there's so many people that have 350 weird symptoms or like one of those 350, and they have no idea what's wrong with them and their lab tests are fine. It's like, no, you might actually have Lyme and no one's really checking for that. And if they do,
Absolutely.
the test barely works. So you still might be
Yes.
negative, So it's like, I consider yourself lucky, not lucky, but like if you have mystery symptoms and you test positive for Lyme, at least you have an answer. It's like the tip of an iceberg, but there's so much just misinformation and uneducation about the disease and so many people that are affected. So anything that we can do in this space to bring awareness, I think is so key. So
yes, I agree with you 100%.
Yeah. Awesome. So let's go back to PR a little bit. So let's talk about, you're working with a lot of these doctors in the healthcare space. A lot of these people are in the Lyme space. What sorts of things do you see kind of happening in the PR space that we're able to bring even more awareness with some of these doctors and practitioners that you're working with and brands that you're working with?
Yeah, I think the really neat thing is, so I went back to work about 5 years ago. Started with one client, one doctor in Chicago, Dr. Casey Kelly, who I love, and she's a very dear friend. And when I started working with her, maybe once every couple of months, we would get a request or land, a pitched piece around Lyme and tick-borne disease or some form of complex chronic disease, right? Like it really was not talked about. It was not considered mediable because the media didn't believe that enough people were suffering about it to click on that link, right? And that's what they care about, is like how large of a community is going to care about my piece that I'm publishing, right? To keep like advertisers happy, for like lack of a better way of putting it. So that was about 5 years ago. And slowly over the course of the last 5 years, I've seen that increase to where now I'd say in spring and summer months, I'm getting at least one, if not multiple requests for like one client or another on Lyme or tick-borne disease, which I think is incredible, right? That has increased that much in the last 5 years. I also really strongly believe that education and elevating these really knowledgeable, factual voices in this space is key to combating the misinformation. And that's why I take what I do really, really seriously. Because if I can elevate these doctors and researchers' voices to the mainstream media, opposed to some random XYZ source that maybe doesn't understand Lyme, doesn't believe in it, thinks it's only post-treatment Lyme syndrome, whatever. I feel like I've done, a good job. If I can even keep one of those voices out of the media, because readers, these traditional outlets do have hundreds of thousands, if not millions, of readers. And if it's like your average person reading it that maybe has never either heard of Lyme or tick-borne disease or doesn't understand why it's such a threat or thinks, oh, it's not in my area, and then they read, Joe Schmo's quote on like, oh, it's extremely rare and you have to have a bullseye and blah, 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 then like they might write off their own symptoms. Whereas if I can get one of my clients' names elevated and provide really good factual information, that might completely change that person's life. So I think I'm building a lot of awareness for Lyme and tick-borne disease that way. Also building a lot of relationships with either like reality TV stars, influencers, people that, I think most of the time for better, 99% of the time, really have a voice in this conversation and can make people aware of the fact that this is an issue, to be vigilant, to do tick checks. These are the symptoms, so on and so forth. I think that's really, really important. Influencer work is so important now. And just through really helping my clients to expand on both a traditional and non-traditional scale in these really large communities, we're helping people, solve their own mystery conditions and get accurate treatment and testing, which I think is huge.
Yep, absolutely. And then which of these types of media do you feel like in this space, like especially for the Lyme community, has the biggest impact? Do you think it's influencers and celebrities coming forward and like saying that they have this so that people can kind of relate and there's more awareness that way? Or do you think it's, doing more traditional media or online articles? Like, what do you feel like has the biggest impact in the space?
Honestly, it depends on the client and depends on the target demographic, just because each media audience is so unique now. Like traditional media is great for building legitimacy. Like if you're somebody that either wants to become really well known, kind of more or less like a household name, sell a product, bring legitimacy to your brand or your person, traditional media is always the way to go, because when somebody Googles your name, they're going to see, oh, so-and-so was in Real Simple. They must know what they're talking about. And for better or worse, that's how a lot of people make decisions now.
And can you explain just for listeners, like exactly what traditional media means and like what that encompasses?
Yes, great question. So traditional media is any type of like a print magazine, a newspaper, a morning show. Like if you're watching NBC's morning show, Fox's morning show, Good Morning America, it kind of blurs the line a little bit now, but even if you're reading like a realsimple.com, right? Because you might get interviewed for an article that is both in print and online. So I would even view that as like on the edge of traditional media. And while we're talking about, I'll tell you like non-traditional media typically would be like blogging, podcast interviews, anything that's like digitally native, maybe like a Substack interview. And then social media is obviously anything like Instagram, Facebook, Threads, TikTok. So hopefully that gives listeners like a little crash course overview. On that as we're chatting. So traditional media is great for building legitimacy. Non-traditional media is great for reaching your exact target audience. Like I actually love podcasts. I think that podcasts now are one of the most influential forms of media. For a lot of my clients, they're the number one biggest referrer, whether it's to their practice, to their product sales, to bringing new Instagram followers in. Podcasts are king, and the audiences are so engaged just naturally. I love podcasts. I think they're awesome. Social media and influencers, I think, are great for, you can either contract out like a macro influencer, which is typically like 1 million plus followers, or a micro influencer, which I view as like 100,000 or less. And there's like obviously a lot of gray area in between there, and use them for very different purposes. Like you can use them for brand awareness, issue awareness. You can also use them for like product sales, educational content. And that I really like influencer work just for like bringing awareness to an issue, bringing awareness to a product, because I think it can be really successful when it's done in a really tactical way.
Yep, absolutely. Yeah, I guess like really depending on like what the client, what the message is, at that point you'll kind of decide which avenue is the best and use them all or just use one, right?
Yeah, exactly.
Awesome. And then I don't know if you're able to share, but what are some of the projects that you're most excited about that you're working on right now?
Yeah. So I am so lucky that I feel like all of my clients do just like such amazing things. So one of the projects that I'm most excited about that we just actually launched was Dr. Bill Rawls, who's the founder of Vital Plan, has 2 best-selling books, amazing human. He just launched his own private network through Mighty Networks. So we have been working on that since the winter, and it just launched in April, which has been super rewarding to see. And so that's been really fun, launching Vital Plan Network and a really, kind of like niche chronic illness and Lyme disease specific network, which doesn't exist yet. He also was just on Sakara Life podcast, which was awesome. Really, really mainstream legitimacy there will help a lot of people, especially suffering from mystery symptoms like we've been talking about. Right now for my client ILADS, which is an international medical society that focuses on Lyme and tick-borne disease and like complex inflammatory disease. We're working on their international conference, which is happening in San Antonio in the fall. So that's a massive undertaking, but really cool to see, like 1,000 medical practitioners, coming together to learn and support each other. Yeah, I think for right now, those are the projects that, everything is super exciting to work on. I think part of the thrill of PR is for me, it never gets old. Every single time I land a media placement and then I see it in print or online, it's like the first time. I will never get sick of like chasing that thrill. So, I think it's really cool that I can say now that, every day brings something new, like one day Casey Kelly's getting interviewed for like Time Magazine, like one day you're launching a social network, and I think that's really cool because this industry just wasn't that large of an industry, even 5 years ago.
Absolutely. So, and then, so how do you select like working with clients? Like, are you to the point where you can be like picky and like make sure that you're aligned with the client to select them versus just being like, oh, I need work, I'm going to take whoever? Like, what's kind of your process? I think especially when you have Lyme and you have limited energy, like you want to make sure that you're putting your time into something that you're going to like feed off of and like be aligned with. So what's kind of your process in like client selection and, working with clients?
Yeah. So I always like to say, first and foremost, Moresco PR is a mission-driven PR firm. So every single client we work with is mission aligned with our own, which is to make patient lives better, to make people's lives better in some way, shape, or form. So that's like the first thing is if you don't fit that bill, it's probably not a good fit, right? And there's probably a better PR firm out there to serve you, quite frankly. Like it's probably not us. The second thing for me is because exactly like you said, right? Like I have limited energy, I have limited bandwidth. It has to be a team or, the CEO executives. That's typically the level that we work at hand in hand with our clients. It has to be people that are really good humans. And that I really get along with. Not to say that every day is like a dream world, right? Because like you have good days and bad days, no matter how much you love your job. But it has to be people that I really enjoy spending time with. And that once again comes back to that mission aligned piece, mission aligned with my own values. Because I don't have time to get like my energy sucked because I just have very limited bandwidth, despite the fact that I operate at a high level now. So for me, that's really what it comes back to is like anything that rocks the peace in my world is just not worth it to me. And I think like when you've been as sick as we have, like you just realize how important that is, right?
Absolutely. Awesome. Well, thank you so much. This has been so informative, a nice little crash course on PR and, making sure that you're using it to do good in the world and help people, which is absolutely amazing. So if people want to find out more about your agency, see if they're a good fit to work with you and just kind of find you online, what's the best way to find you and some of your projects?
Yeah. Anybody listening, please reach out. Love elevating voices of good humans. My website is amorescopr.com. And whether you are a doctor, a brand, or a patient listening that just wants to not feel so alone in their journey, you can always send me a message at Allie T. Moresco on Instagram. I share not only about work, but mostly just about my life dealing with Lyme and tick-borne illness, and my day-to-day. And I just like connecting with people. So thanks for having me today.
Yeah, absolutely. And we'll link to everything in the show notes as well, so people can find you and follow you. Awesome. Thank you so much.
Thanks, Erica.